Welcome. Come on in. Now that your pre-operative testing is complete and you've set a date for surgery, I will try to ease your concerns by telling you exactly what to expect while you're in the hospital. The first and best piece of advice I have for you is don't be in a big hurry to return home. Your surgeon is the best judge of when discharging you is safe. And having a family member or a friend stay with you is a personal decision, but a good one if they are supportive of you. If they're not, and they volunteer to stay with you, it's better to say, thanks but no thanks. Now there are few factors that will control how long you will need to stay in the hospital, including the type of surgery you've had, your own physical condition, and how much support you have at home. If my patient travels a distance to have their surgery with me, I'll usually discharge them to stay in a hotel near the hospital. You have to remember, during your hospital stay, you have a large team of professionals taking care of you, including nurses and technicians who draw blood or do x-rays. Also the dietitian who reviews what, how, and when you should eat when you go home. In short, it's nice to have professionals around to help you feel comfortable and well taken care of. Now, when it comes to getting out of bed, the first few times can be hard, but it's super important you stay active as much as possible. If you use your abdominal muscles to get out of bed, you might feel some pain. So it helps to roll on your side and then push yourself up with your arm. Try to walk a few minutes every couple of hours, if possible, to reduce the risk of blood clots forming in your legs. Another important measures that hospitals should take to prevent blood clots after surgery is to provide compression stocking and a leg device to squeeze the calves. Personally, I send most of my patients home with blood thinner shots for 2 weeks to reduce the risk of blood clots. Pain management is crucial for staying active and avoiding blood clots, and most surgeons will offer a choice of narcotic and non-narcotic pain medication. Also, if you've had a good experience with a particular pain medication in the past, be sure to communicate that with your surgeon so they can prescribe it for you. I know many people think surgeons are mean, but it's not true most of the time. We do want your pain controlled as much as possible to help you recover fast and minimize the risk of complications. Now, after surgery, you will find that food sometimes goes down and other times it does not. Make sure you're not eating too fast and not taking too big a bite. And be sure to chew, chew, chew. Also, nausea is a common side effect of stomach surgery, and taking narcotics can make it worse. So it's important to take your prescribed nausea medication as needed to prevent vomiting and help manage your symptoms. Constipation is one of the most common complaints after surgery, and it usually means you need to drink more. Also, feel free to use over-the-counter constipation medication. Constipation can cause hemorrhoids. They taught me in med school that hemorrhoids ain't fun. Finally, hair loss the first few months is another unpleasant side effect of the surgery. Your hair can come out in what looks like clumps. You may notice it in the shower drains and in your hairbrush. There is no cure for the hair loss. To limit it, make sure you are having 60 grams of protein daily. Also, you can try a hair and nail vitamin or try taking zinc, vitamin E, or biotin. I promise you the hair loss will stop after a few months. I never had a patient go bald before. If you're already bald, I do not expect you to grow your hair after surgery though. Surgeons are not magicians, except when it comes to making pounds disappear. Okay, enough with boring surgeons jokes. I will catch you in the following video.